and much, much more. Now, today, in an ever evolving world where health concerns continue to grow, we're shining a spotlight on a topic that concerns a lot of young couples who are planning to start a family. You might have guessed it, it's infertility. Now, the WHO has revealed that 1 in 6 people suffer with infertility. Now, that's a lot. And in today's busy and fast paced world, juggling work, social commitment, self care can itself be a real challenge. Now, the stress and demands of a hectic lifestyle can take a toll on various aspects of your health, and fertility is no exception. Now, irregular sleep patterns, high stress levels, poor dietary choices, and limited time for relaxation can all contribute to this disruption in hormonal balance, and that has an effect on reproductive health. Now, to help young adults plan their families and tackle infertility, we have with us Dr. Jyoti Lakhani. Welcome back, Dr. Jyoti. Dr. Jyoti
Thank you.
is a
Thank you,
founder and
Kritika.
chief physician. You are welcome, Dr. Jyoti. And so she's the founder and chief physician at Ayur Healing in Kolkata, and she has more than 15 years of experience in clinical practice, research, and education in the field of Ayurveda. She holds a master in psychotherapy and counseling and a bachelor of Ayurveda medicine and surgery. She has expertise in treating both acute and chronic cases using only classic Ayurvedic formulations along with Panchakarma, meditation, and yoga. And today we are honored to have her again for this live session where she shares her information with so much passion. Welcome again, Dr. Jyoti.
Thank you, Kritika.
So let's not waste any time. Let's dive into the world of infertility and how we can tackle it with Ayurveda. So, Dr. Jyoti, first question. How does Ayurveda approach the concept of infertility?
Uh, it's a very important topic we have taken today, Kritika. I think most of the people are suffering and they have been fooled by different treatments for taking for giving birth to a child or getting pregnancy is a very emotional thing which every woman has to face if we are going into the normal process of life. So this is, I think, something which might give people some awareness that don't come to Ayurveda at the end. Usually the people come to me also. Now they have taken treatment for the 15 years, some have taken for the 10 years, some have taken for 5 years, some have taken for the 3 years, 4 years, and they have not got any results. In fact, their hormonal system has come down, their body has changed by taking heavy doses of hormone pills and plenty of other, dangerous medicines, which has not helped them. I think very less people can get the help. Maybe naturally they are able to conceive, but mostly people are not able to conceive. In fact, they end up in some kind of fibroid, or their cycle of the periods changes, or continuous bleeding is there, or some other issues. I have seen this practically in clinical form. I'm telling. Whenever we come to this Livayur, I always talk about clinical aspect. I don't talk about what it is being told in classics. I'm telling which can happen, which can help people in everyday life. If like somebody from my home has to go to conceive, need some help, I would definitely tell them to go first to an Ayurvedic physician, and then if you're not successful, which is not going to happen, it will be successful 100%, and then you go for any other treatment if you want. But don't come to Ayurveda at the end. So I started my thing with this because usually the case I find they come to Ayurveda at the last. And when they come at the last and all the things have disrupted in such a manner that we have to take plenty of time to get the things on the normal platform, and then we can start the treatment. Such disruption in people's life, and at the same time they have lost their patience on the behalf of money, on the behalf of their psychological status, and plenty of other things. So I tell them, people, I just through this platform, I just request everyone that if you're trying to conceive and not able to conceive till 1 year of your married life without using any protection, that is called as infertility. You're not able to conceive naturally. So let's start with that note. Infertility is a condition when you're not able to conceive. Uh, in fact, if you're not using any protection, then also you're not able to conceive normally. That is kind of infertility. There are different forms of it. There are different varieties in that. Ayurveda has given importance to this branch of science since it plays very important role in people's life, because I think the human body has taken birth and then the whole life moves on like this, that we have kids and then life moves on. So every mostly in India especially, we give importance to these things, and I think it is very good. So I start with the note that the route we go has different aspect. Since this is a huge, it is a huge topic, we'll try to make it in a short form and represent you. So if we talk about the root causes of this, so we need to know the stage of this body, stage of the disease, stage of the doshas in your body, stage of the dhatus in your body. These days, if we are looking at, let's go to the root of this, that how it is happening. PCOD, like suppose one of the condition which is very common these days, and there are other tubal blockage. We can see there are hormonal imbalance, loss of, or there is deficiency in hormones like AMH is very low, and there are plenty of other things. And in few patients, I've seen testosterone is very high, progesterone is very high or low. So there are either extreme of anything or there is deficiency of anything.
Okay.
So we
Proper
need to
balance.
understand. Yes, we need to understand. And I'm telling people that Ayurveda has the deep-rooted treatment for this, which is very easy. You just need to understand your body well, which we have this dosha tool in Livayur.
Okay.
Kritika, you know, na this
Yes.
dosha. Yeah.
So even with infertility, I noticed that doshas come into play, and that kind of helps us understand better what kind of imbalances there could be. So if you're curious about your dosha, you can always go to Levayur and use the dosha tool to help you identify what your doshas are and what kind of treatments you should seek out for if you're having a problem. Now, Dr. Jyoti, you mentioned, root cause of infertility can be many things, including conditions like
Many
PCOD,
things.
many things. So I mean, is there one specific root cause, or
There
it's
are
a
plenty.
combination of
There are
everything?
there are plenty, Pritika. So
Okay.
if we'll go for basic thing, now I just need to let people know what are the basic things in Ayurveda we try to diagnose, or we try to work on, or we try to treat people. So there are one important thing is human body has made in our form that we have 7 dhatus in our body. So
Okay. Okay.
when we the other dhatu, can you hear me? Am I audible,
Yes, Dr.
Ritika?
Jyoti, you're
Fine.
audible now.
Yeah, yeah.
Yes.
So
Yes.
when we have our food, we our life from the time we took birth or we were in our mother's womb, from that day till we go to our deathbed. I think one thing which is very common is we need to have some food which nourishes your whole body. So what is
Correct.
that process? The process is the first dhatu which comes out of the end of the digestion is the dhatu, and the waste product which goes out of the body. So from the rasa dhatu, the nourishment goes to rakta dhatu, which is blood. And same, there is a chain of dhatus like rasa, rakta, mamsa, medas, asti, majja, and last is shukra dhatu. So shukra
Okay.
dhatu comes at the end of this. So we need to understand that any medicine which has to work on the shukra dhatu, means reproductive system, has to
Okay.
pass through the 7 dhatu system. So
Oh, okay.
when we always talk about the root cause of this, the root is always metabolism, your
Okay.
digestion, your
Okay.
end product of the digestion. That is very, very, very important. That's why I tell people not to take your digestion very lightly. Usually, if just little upset with the stomach or acidity or constipation, people are, if you ask out of 10 people, 8 might have these problems, but they
Okay.
ignore it till a time they end up in a huge disease or a big
Okay.
disease. So
And
we,
usually these, like something like indigestion or something, people I think these days are looking for quick fixes,
yeah,
something to just like pause it for one day, but then like you said,
without
it's
even
just
understanding what are the side effects of the medicines which are they're taking for the quick relief. And Ayurveda doesn't, it is absolutely a wrong myth that Ayurveda doesn't work quickly. It works. I am practicing every day. Ask my patient, come to my clinic, you will come to know how Ayurveda works. It works very fast. Within 1 hour, 2 hours, within 5 minutes, 10 minutes, I have seen people how it is working. It works very fast. This concept that Ayurveda works very late is being told by somebody else, and it is being printed over here. So that myth we have to take out from the people's mind. So we were there
Absolutely.
that how we can, the root is again your metabolism, again your lifestyle, again your because there is one thing, one of the main factor for infertility we have seen is stress also. These days
Okay.
life is so fast, we have put on so much pressure on girls because girls are mainly responsible. In Ayurveda we say there are four things which are required for the proper conception, which we call them ritu, kshetra, ambu and bija. Okay.
Okay.
Ritu means the ritu is in normal meaning we call it a season, but
Hmm.
ritu means your menstrual cycle, the
Okay.
proliferatory phase of your hormones, your ovulatory time. So ritu is very important. So these days the stress is too much for even a girl. She has to get up and stand up on her feet. She has to study hard. She has to boys in some way. I mean, tell your girls not to compete them. You're already beyond them. You're beyond above them. So don't need to go into that competition. On that level, we have started smoking. We have started drinking just to compete with the male, generation. We don't need to do this. Uh, I can tell you one of the treatment we do for the women who are not able to conceive is we try to tell them to put on an Indian costume, like putting your necklace, putting on your pile. All these helps to stimulate that particular hormone. It
I see.
helps.
That's very
Yes,
interesting. I think
yes,
our culture has secrets
yes.
that
It
we've
has,
forgotten over time.
yeah, it has some scientific logic. So for the usually nowadays the girls are trying to wear like a wear their clothes like boys. So the कहते हैं ना जैसा हम खाते हैं जैसा हम रहते हैं we become like that. So this is what is happening with us. The hormones are changing from female hormones to male hormones, and now we are
Okay.
seeing same sex and plenty of other things which are coming out. So that is why we need to understand the basics of it. It is not only for
Okay.
conceiving, for getting your body into a right position, hormones into a good position. These days we feel so frustrated, so exhausted. For every little thing, the girls are having it goes into anger and frustration. Suicide is very common, and pressure from the in-laws to get pregnant herself, that we need to calm one thing. If we are stressed out, it is going to hamper it more, it is going to trouble it more. So we need to understand that just by following some good Ayurvedic habits, you can come, even stress can be relieved.
Now
These
we
are the
have
major factors which I am
absolutely.
discussing right now. These are the major factors which I'm practically dealing with people every day.
So
And
lifestyle
Ayurveda
is,
has
yes.
very good line of treatment, diagnostic factors. Everything is so good that people get a right way of understanding themselves, going into right direction, and then ending up in getting very good results within 2-3 months.
I mean,
In
happy
few
to hear.
patients we have
Yes. So,
in few patients we have seen their next cycle is normal. They're
okay.
conceived even in their next cycle. So
Okay.
like it depends upon your body and time.
So we have certain, lifestyle, diet, those questions as well. But coming to one curious question, which is, are there any specific Ayurvedic therapies for male infertility?
Yes, there are plenty of them. We always start with correcting the metabolism. We
Okay.
involve panchkarma if it is required.
Okay.
Basti is one of the best treatment if you have tubal blockage, if you have PCOS. Uh, you will not you'll be amazed that PCOS we usually treat in 1 month or two max.
Okay.
It's fine by just correcting the lifestyle, giving few medicines with that, it is working so well. And we go on evidence based. Do this. We do the reports now, and then after a month, every month after a cycle, we go for reports.
Okay.
So they are very good treatments. We have very good. Try to do it with the help of simple medicines, basic few medicines, and some therapies at home.
Okay.
And if few patients, if it is like suppose it is very chronic, they are full of toxins. So we try to detoxificate them with the help of Virachan Karam. Virechana is one of the
Okay.
specialized Panchkarma therapies we do. And after Virechana, we go for Basti. And one of the important Panchkarma
Okay.
therapy which works very well on the hormonal level in the brain is Nasyam. Nasyam works too good
Okay.
for the patients who are not able to conceive. Now you can see the
Okay.
correlation of your brain and your ovary and your reproductive system. We stimulate your
Okay. That's
hormone
what I
system
thought.
over here, and they stimulate
Okay.
your hormone system in that particular area. So we
The
whenever we
body, I
talk
mean,
about
so
four
interesting,
things,
so connected.
yes, yes, yes. So I would like to tell people that four things we have to work on. Ritu is your period or cycle or your season of your hormonal level. Then Kshetra is the place where child has to come and conceive. That is the uterine cavity, female genital tract. Also, it comes under this. Ambu is the metabolic product like glycogen, hormones. All these are considered under that. And Bija is the ovum and sperm. These four things which we work on, people. If we work on these so four people, everything is this is called as samigri for conceiving. The things we
Okay.
need to conceive. So when we work on
That's
these
the
four
holy grail.
things, automatically when these are corrected, you will be able to
Okay.
conceive. So we are just
Okay.
trying to get those conditions on the basis of which a person can conceive normally. We don't
Okay.
go for any other things. We like if AMH is low, you cannot conceive. It is absolutely nothing like that. We
Okay.
try
Okay.
to develop those conditions in your body that your AMH will automatically come up. Usually,
Okay.
by taking other therapies, AMH always goes down. But in
Okay. Okay.
Ayurveda, it always comes up. So, by it depends upon the type of patient, the type of problem they have. They have hormonal imbalance, they have tubal blockage, they have menstrual issues, they have periods issue, they have their stress issues. Whatever they have, we treat on the basis of their typical conditions.
Okay. And now you did mention AMS, right? What is that exactly? Just a very quick for those of us who
This is
might
a
not
hormone
know.
which is required for the proper ovulation. That's it.
Okay,
So
understood.
yeah, it has been given
Now,
very hype in the modern science, but we don't
okay,
take it that high. We take
okay,
these things more important, which I told you.
okay, understood. Now we know the lifestyle in this modern day and age is very busy, and the age of conception is getting pushed further and further for not only women but also the men who help in this. So, are there any age-related fertility issues, and how does Ayurveda help in managing these age-related fertility
Very
issues?
well. We have very good lifestyle changes. We have very good medicines also, which helps people to what do we call it is we stop the age to move further, kind of thing. There are very good medicines which is called as Vayasthapan. What we do is we try to give them the medicines by which they don't get much older. We make them try to younger. Yeah, with the help of
Okay,
those therapies and medicines, we try to make them conceive even at the age of 35, 40, we can help. And sometimes
okay,
even at the age of 41, 42, also we try to help people to conceive. But it is
okay,
it is
interesting.
not going to help in every patient. It depends upon patient to patient. But yes, Ayurveda has very good treatment for them also.
Okay, that's good to know. So, if there are any kind of older audience members who are wondering if Ayurveda can help, it totally can. Now, the diet is something that we spoke about. Digestion is something that we spoke about. So, in Ayurveda, are there any strict rules when it comes to trying to conceive and food?
Absolutely.
Okay.
Absolutely. We work on Agni. Ayurveda we need to understand but whenever we start our treatment with the patients, we always try to tell them what we are going to do in their body and how it is going to act and what results you're going to see. So whenever we talk about any kind of treatment in Ayurveda, we always talk about Agni, your
Okay.
digestive power. So that is very important because there are different types of Agnis in your body. One is
Okay.
which digest your food, one is which digest to help or to nourish your dhatus. And in dhatus, Shukra dhatu is one of the dhatus. So Shukra dhatu Agni. So we work on that Agni, how we can
Okay.
stimulate that Agni so that we can do some Bhedan Karam so that the ovulation can be done properly. Bhedan is going deep into the ovaries and getting out the ovum properly. That is called as Bhedan Karam. So we do
Okay.
different kinds of therapies that help people to, you know, we act on that typical sign and symptom. We act on that particular point where we can, get the sure short results. So Ayurveda works in that way.
Now, there is like common rumors, or I don't know what to call it, but random things like if you eat papaya, you will not conceive, things like that. Are those true? Are there any food products or foods like that that can maybe cause a delay in fertility?
See, it is nothing like that. Papaya doesn't stop infertility. Papaya is little, what we say, we have two things in Ayurveda. People need to understand that there's nothing it can harm to your body and you cannot conceive. There's nothing like that. For
Okay.
few people, it has a old concept of, dadi, nani types, that if you have papaya, you can, abortion can happen because
Yes.
the papaya is little hot in nature. In
Okay.
Ayurveda, every food has two kind of effect in our body. These are called as after effects. One is immediate effect, one is after digestion, the effect it causes in our body. So papaya is one of the food which causes little hot,
Heat.
which is little hot in nature. So that is
Okay.
why there's nothing like that that you cannot conceive if you take papaya. In fact, we all should take fruits and raw vegetables only depending upon our type of agni we have, type of
Okay.
digestive capacity we have. If human body is not meant for, human body is not meant for raw food. So if you want to have raw food, you have to see your agni. You have to see your digestive power. If you can digest it well, you can have. Otherwise, you cannot have.
Okay. Okay.
For
Interesting.
all the food things, this is going to applicable. This rule is applicable.
Okay, so make sure you pay attention to your body, and if you have any doubts, please reach out to Dr. Jyoti or any Ayurvedic practitioner to get more clarity. Now, coming to lifestyle changes, Dr. Jyoti, it does Ayurveda suggest any lifestyle changes for couples who are struggling with
Yes,
infertility?
definitely. These days, both couples are, which I'm usually doing in my couple counseling, is try to spend whatever it is. Try to spend some time with each other. I have seen some couples that they're staying so much away from the day of their marriage till like many years of their life, and they don't have that emotional connection with each other. And there's, yes, these hormones are connected with the emotional stress level or emotional level of your body. So I usually tell them to give time to each other, there for each other, giving importance to any other things. Like these days, mobile is one of the, enemy coming between the couples. So just we have to be very strict with ourselves that nothing is going to come between us, or whatever time we need to give to each other. Yes, I tell them to take the couple counseling so that they get closer to each other. They have more emotional and good bonding. You want to conceive, that is okay on one side, but preparing yourself to conceive properly and taking out a healthy normal child is the more important thing, I think. Just thinking about it and talking about this doesn't work. It works when you have to work on
Absolutely.
it. Yes,
And yes, intimacy is not just physical, it's also
exactly.
emotional, like you
Yes,
mentioned. And that can also have a subconscious effect on your body, on your fertility
100%
as
it
well.
has. It has.
Yes. Now, anyway, on the note of emotions, how does Ayurveda view the role of emotions and mental well-being on fertility?
Yes, in Ayurveda, if you talk about the definition of health, so they have talked about the mental health is equally important as compared to physical health. It has always been taught since thousands of years, and we are seeing it every day. That every human has given importance to their mental health. If they're mentally they are fine, physically they can manage. If physically they are fine and mentally they are not fit, they're not going to manage well with the life. So
Absolutely.
Ayurveda has always given importance to mental health. That is why the meditation part plays very important role, and the counseling part, which comes with the patient. In whenever the patient comes to me for infertility cases, I always try to start with the couple counseling, and then we move on. If they're not coming together, I don't start the treatment. That's my rule.
Okay. That's nice. That's good to know. Now, are there any, like, when you talk about, you talk about both couples coming together and having that session with you, are there any practices that couples can adopt once they go back home together? Are there
Yes,
any practices that they can
yes,
adopt to
yes.
encourage conception?
See, whenever if there is the topic of infertility, female is always being targeted, and never it is nothing like that. Most of the patients come to me, the males is having some problem, even females are fine, absolutely fine. So I just give them some kind of activities. First is like my treatment is always for both. Okay, then start with their counseling. I always try to give them some activities to do together. Then their lifestyle will be same. They both have to follow same kind of lifestyle so that they can spend more time with each other, and plenty of other activities which we give, like go for a date. There are different activities we give them, and then after the next session we ask them how it went, and they were very happy couple, and they start conceiving very nicely, and it happens. There are plenty of
Okay.
other activities. We try to give them some yoga therapies together. So like that, there are different therapies we give them. Even detoxification, panchkarma also we give them both. For detoxification, I tell both the couple, like both the male and female, to come and take it if it is required. Only if it is
Okay.
required, then we go for it.
Okay. So from what I hear, some of these problems have simpler solutions than we expect. Just
Yoga,
spending
yoga,
time
yoga
together.
asana plays very important role in infertility. I've seen very good
Okay.
results if couple they try to have it together under a proper,
Okay.
coach under a proper coaching, this thing yoga therapist, then only they get
Okay.
a very good result. So yoga asanas are very important. But most
Fantastic.
important is your lifestyle. If you're happy,
Most
active,
importantly.
mentally fit, and you're having your food nicely, it is being digested properly, and everything is your waste product is coming out normally, and all the four things which I talked about, kshetra, ambu, bija, and ritu, these four things are the most important things which we work on when we talk about infertility. So we work
Understood.
on that.
Absolutely. That's good to know. And if you have audience, if you have any doubts on some of the aspects that Dr. Jyoti has mentioned, please feel free to go to Livayor. All this information is there.
This is a huge topic,
Um,
Pratika. We cannot cover this in just.
mhm.
We can take on
Yes,
some details of into future sessions, that where we can particularly talk about male fertility in female fertility. I'll try to do that later.
sure, sure. Now, coming to, Ayurveda is always synonymous with its special medicine. So, are there any herbs or special medicines that is purely Ayurvedic to help
There are
improve fertility?
plenty. There are plenty of them.
Okay.
I cannot take the name because people will start taking on their own. But yes, like
Yes.
Shatavari, hai, we have Ashoka, we have Shatapushpa, we have plenty. So there are plenty of medicines, but medicines can only be given by seeing your condition. For every condition, one medicine will work. It's a myth. It's a wrong thing. And for every symptom, you will give 10 medicines. It is not going to work like that. So medicines can be under only trained medical practitioner, by seeing your dhatu stage, by seeing your the stage of your disease, by seeing the stage of your doshas. We prescribe the medicines, but in very small quantities, depending upon the type of disease, type of infertility, type of dosha dhatu involvement and stage.
Okay. Like we say in every Livayor webinar related to Ayurveda, please don't self-diagnose, please don't self-medicate. Always reach out to a, a professional and a doctor like Dr. Jyoti. Now, finally, Dr. Jyoti, are there any ebooks or any places to find more information about
Yes,
infertility?
Livayur has very good articles on this. I tell people to go on livayur.com and find out your prakriti, find out plenty of things are there. You will come to know about plenty of things. You will get the proper information as per Ayurveda. You will get to know about the good doctors around you and plenty of other things. I think people should find out the exact thing so that they get the right treatment at the right time.
Thank you, Dr. Jyoti. The link to this ebook will be dropped in the comments if at all any of you are curious. Now, we are at the end of our time, unfortunately. Thank you, Dr. Jyoti. As always, a truly insightful session with you. And thank you for sharing such detailed information. And I'm sure you see many kinds of patients in your daily practice, and you've given us information that has helped real people. And Thank you for that, Dr. Jyoti. Our next session is on arthritis on the 17th of November. I would like to thank you, audience, for being a part of this and coming back and enjoying these sessions with us. Awareness with Ayurveda is very important because the first thing that comes to our mind is a solution that is a quick fix. But Ayurveda is there. Please remember Ayurveda. Don't think of Ayurveda as like the last resort. Keep it in your first options as well. Now, with this, we'd like to end the session here. Audience, you can visit Livayur website and follow us on social media for regular updates on Ayurveda and the Ayurvedic lifestyle. Thank you and have a wonderful Diwali. See you in the next one.
Happy
Thank you,
Diwali,
everyone.
everyone. Thank you.
Happy Diwali. Thank you, everyone.